Hello, and welcome to another episode of Boomer Health at Home. I'm Maggie, Ornazian, your host and Director of Nursing at AmeriCare Nursing Services. I'm joined again today by Meghan Gervin, Nursing Supervisor at AmeriCare Medical, Dr. Russell Faust, Medical Director at the Oakland County Health Department, and Shayne, Boyce, Epidemiologist and Administrator of the Nursing Services, if I'm correct, at the Oakland County Health Department. Good morning, everyone.
Good morning.
So we did introductions in our last Zoom quarantine interviewing. So we're not going to go through all that today, but we still are going to touch on COVID-19 and all of the issues that surround this. Thank you again for all being here today.
You're welcome. Appreciate it. Glad to be here.
So I was just reading actually in the Wall Street Journal about, I think it was yesterday, Hong Kong reduced a lot of their infection rates through wearing masks out in public, everyone wearing masks. Was that something that anyone else read or can talk about? Do you guys think that wearing any type of mask at all is probably just the best type of prevention in this climate today?
Let me just clarify. China was able to reduce infection rates through a aggressive multi-pronged effort. That is, it wasn't just wearing masks, it was shutting down Wuhan, shutting down their borders entirely, 100%, and many other approaches, I'm sure. So to attribute their success to wearing masks in public, I think doesn't really, provide the full picture, although that's certainly one great effort. And I think that's appropriate for U.S. citizens to be out in the public wearing a mask. Now, we touched on this a little bit yesterday, but the challenge has been that CDC is aware there simply aren't enough masks to go around in the United States. We don't even have enough for our frontline healthcare providers and our EMS and our fire and law enforcement folks. So CDC was really unable to say, hey, everybody needs to wear a mask. That just wasn't a tenable approach. And so they tempered that early on and said, nope, nobody needs to wear a mask if they're out in public. Save all the masks for healthcare and all these other frontline responders. I think because we've been collecting data globally and we have the Chinese experience, we have the South Korean experience, and we have the European experience now and experience here in the US, I think CDC has been accumulating data, and now it's clear that you can reduce spread of coronavirus with a simple mask, not even an N95, the really hardcore filtration mask, but even a simple surgical mask. And again, because there is a shortage of those simple surgical masks, they wanted to save them for healthcare providers. They examined these homemade methods. So homemade methods of a homemade mask sewed up on a sewing machine, or even there, as we kind of touched on yesterday, there are these methods, multiple videos on how to use a scarf or how to use a t-shirt or something like that to create a mask at home that you can wear in public that doesn't require sewing. So I think that's the right approach. I think at this point on the curve, I think wearing a mask when you need to be out in public for essential reasons, groceries, I think a mask is appropriate. And I think Shayne has, an opinion on this as well.
Yeah, a lot of discussions been talking about masks and whether to wear them, whether you shouldn't wear them, what kind of mask do you wear. A lot of conversation about that. And it's not just about whether or not you wear a mask. I want to reiterate something that Dr. Faust said about China and a lot of other countries that have been able to get a little bit of control on coronavirus, such as South Korea. It's about a multi-pronged approach. You don't want to just wear a mask and say, I'm good, I'm wearing a mask, and give yourself a false sense of security. What ends up happening is when you're wearing that mask, if you're not used to it, your hands are going up to your face. touching your face more likely to touch your eyes, your mucous membranes, and possibly infect yourself that way because you're adjusting that mask. If you aren't properly fitted for the mask because you're just wearing any mask, it might not be fitted properly. And so what ends up happening is you think you're wearing that mask, you think you're out in public, you think you're completely safe. And so you stop doing all the other prevention efforts, the physical distancing between you and another person, the 6-foot rule. What happens if you're wearing a mask and another person's wearing a mask and you're trying to communicate with each other? Sometimes it can be hard to hear through that mask. So what do? You step closer to that person to hear what they're saying. Or you speak louder and you shout louder. There was a CDC investigation of a choir practice where there is an infectious individual there, and there was actually a higher rate of infectiousness from that choir because they were singing, they were shouting at a louder voice. And so when you're wearing these masks and you're shouting, yes, you got a mask on, you're good, but if you're infectious, if you're talking louder, that's possibly expelling more virus out there. So masks are an important part of prevention efforts. It's the only prevention efforts. And that's something that I think we all really want to remind everyone of, is that it's a multi-pronged approach.
And it did mention in the article that they implemented the social distancing so much sooner. They did it right off the bat. And I think, like you're saying, a multi-pronged approach that really does add it in, whereas we waited here, or people just aren't following it. I think a lot of people are a little bit confused on what that means. And they're still allowing their neighborhood kids to play together. They're still, going over to their neighbor's house. So if someone isn't living in the same home as you, should you be visiting with them?
Absolutely not. And I think you're right about the differences. Certainly, we're not a communist country, and they were able to just absolutely shut borders, shut everything down, ignore the whining, ignore the political blowback. That's a real challenge here in the U.S. And certainly the politicians early on have struggled with the pushback from companies and pushback from the general public. And I think a lot of the early information regarding, say, demographic of people who were becoming infected or had severe symptoms, the older demographic, I think a lot of that information did us a disservice, and that, the younger generation said, hey, not my problem. I'm not going to be infected. This isn't my issue, and continued to go to bars and go to parties with their friends and just generally hang out at the mall or what have you, until those venues, began shutting down based on executive order, based on the governor's orders, based on the executive Coulter's orders here in county. And I think a lot of that, in comparison to someplace like China, was very late in the process. You're absolutely right.
Okay. And now you had mentioned the curve prior, and everybody hears flatten the curve, or the peak. Can you explain a little more about that for people that just aren't up on it, that don't understand what that means?
I think basically, when you're looking at an outbreak situation, an epidemic, this is a global epidemic, so a pandemic. But when you're looking at an outbreak situation, the number of cases are going to, you're going to start out low and then start to accumulate cases, and they're going to peak. When that happens across a country or even across a city, your healthcare systems will be overwhelmed. Your hospitals won't be able to manage that influx of patients. And so it will benefit the systems and those people who are becoming ill if you can reduce that peak, if you can delay that peak so that it spreads it out over a greater amount of time. So you don't have an immediate spike of thousands of people becoming ill at the same time. What you really need to do is you need to flatten the peak. You need to flatten the curve and spread it out over time such that those people can they can still get into the emergency room. So over a longer period, yes, it prolongs the overall epidemic, but the advantage is that everybody can be cared for. The healthcare system can still function as it should instead of being overwhelmed. So that's flatten the curve.
Yeah, and when you're doing that, you got to think about the healthcare system. You got to think about all the different resources that go into assisting those that are so with and hospitalized. There is, unfortunately, a finite number of ventilators. There is a finite number of healthcare staff to assist people who are in the hospital with coronavirus. And we want to prevent the healthcare system from having to make tough choices like who gets the ventilator and who doesn't. We'll slow that rate of infection so that the number of people who are getting ill, even if the percentage itself might be a smaller percentage of those who are ill and are actually hospitalized, when you have a large number of those infected, that small percentage can still be a really big number. And so we want to slow that rate of infection as much as we can so that although it's a small percentage, we want that small percentage to also be a small number of people getting hospitalized over a longer period of time. So all those ventilators, all that healthcare staff, all that personal protective equipment isn't exhausted in all one fell swoop. I saw a meme one time that said, you ever want to understand what it's like for the healthcare system to be overwhelmed? Well, when everybody made a run into the grocery stores and bought up all the toilet paper, and now there's no more toilet paper on the shelves, it's the same thing. If everybody goes after something at once, the system is going to get overwhelmed and things are going to be unavailable. Now, that's perhaps a poor analogy, toilet paper and
No, it's not.
System, but it's appropriate. It's the same thing to help people understand what it means for a system to be overwhelmed.
And let me just add to Shayne's comment. It's not just the healthcare staff, which of course it is, and it's not just the ventilators, which of course it is the ventilators. It's all of the moving parts and that support that system and getting those people intubated and sedated and cared for. It's the number of beds, it's the number of ICU beds, it's the ventilators, it's all the medications that are required to safely and successfully get somebody sedated so they can be intubated and put on a ventilator and kept safe and healthy while they're on the ventilator. And frankly, as those systems have become overwhelmed, there have been spot shortages across the country, including right here in Oakland County for some of our hospitals who simply don't have the medications necessary. And fortunately, most of the hospitals have been very altruistic and have been shipping shipments of those needed medications and parts for ventilators and staff, nurses coming from out of state. But you know, that makes the whole process a little bit risky, and it delays the process of caring for people. So it's beneficial if we can flatten the curve.
So you mentioned that Oakland County, we've run out of some resources or we're, bringing more in. Why is it that Oakland County, Macomb County, and Wayne County have such higher numbers? They're in the thousands. And then surrounding communities don't have nearly as many.
Well, one of the reasons was that across the country early on, when international flights were shut down, they were funneled into 11 airports. And Detroit Metro happened to be one of those 11 airports. And so we still had people coming in from international travel at that time. And in fact, the first cases we had were very clearly related to international travel. Or someone living with somebody who had just returned from international travel. So I suspect that that's the primary nidus or source of the initial cases. And then, because we haven't done a great job in shutting things down in the United States early enough, that is in terms of shutting down all but essential services and keeping people isolated at home, sheltering in place. those people were out and about, and before we know it, bang, it's in the community and widely spread in the community. And I think that's what happened here in Southeast Michigan.
And in general, when you talk about infectious diseases and something that's as spread as easily as coronavirus, when you are in a urban environment, when you are in even a suburban environment, people are just in closer proximity to each other. You're in those neighborhoods, and it just offers opportunity for when you are in a democracy like us, when you are in a country where there is still some movement going on, whether it's essential workers or, as you talked about, those instances where you might see occasionally on the news, neighborhood kids playing together or people still congregating here or there. If you were living in a less populated area, that's harder to do when there's a rural area and you just have not a physical distance of a few hundred feet between you and your closest neighbor, but a few miles. It's more difficult to have those interactions. And going all the way back to Thomas Jefferson's time, when there was outbreaks of smallpox, this is something he knew about. He really promoted the idea of America when it was moving out west and developing out there, that they shouldn't develop in big urban areas because of one of these very reasons. But for any number of economic reasons and just people being people, that didn't actually end up happening. But his idea was kind of on the right track. One of the reasons why New York City probably has had such difficulty in really just tamping down the infectious rate isn't because they're not trying. I mean, they're throwing a lot of resources at it to try to do it, but they are such a densely populated city, people living on top of each other in apartment complexes where if they're going to get food, they got to go out or people got to come in and deliver it to them. It's just a lot harder to physically distance yourself and socially distance yourself from those areas. So when you look at a lot of case numbers and a lot of infection rates, it kind of follows the density of where people are. And again, coronavirus is not a disease, at least as far as infecting people go, that discriminates. It'll infect you in a rural, suburban, or urban area. It's just an easier time to do so when people are closer together naturally.
Very good. So speaking of, being on top of each other and doing all this wonderful stuff, a lot of people, us included at AmeriCare Medical, we've had to kind of add in additional services and kind of change the way we're doing things to make it work. For example, we're going out and drawing patients' blood and dropping it at the lab for them so they don't have to go to a lab. Now, do you guys have some resources through Oakland County to where people could kind of get a doctor's visit or, maybe something telehealth wise? What do you guys see this going forward or what you guys already have?
That's a great question, and thanks for what you're doing. We actually have multiple services right now that are ongoing. Some of those services are here in our clinics at North and South Oakland County Health Division clinics. We continue to see symptomatic patients with, for example, sexually transmitted infections. We continue to see our HIV patients. We continue to see our tuberculosis patients. And we have, I think, the largest active TB team in the state of Michigan right now with the most active patients. So we continue to see those folks and we just couldn't abandon them. When we do see patients or clients here at our clinics, they come see us by appointment only. They are screened at the door. Their temperature is taken, and they come in one at a time and are taken directly back to a clinic room where somebody assesses and cares for them. We have largely moved our tuberculosis assessments, and the standard of care is something called directly observed therapy, which is often face-to-face at a client's home. We've moved virtually all of that to video online, so that's been beneficial to prevent bilateral exposure, to prevent exposing those clients, to prevent exposing our public health nurses. In addition to those efforts, we've also partnered with a local federally qualified health center, and that is Honor Community Health. And frankly, patients that, patients that we're unable to accommodate simply because of the schedule. We can only see a limited number during a day. If we're scheduling them for appointments and seeing them, come back in one at a time, so they're not exposed to others. Honor is also providing similar services with us now. And in fact, Executive Coulter a month or two ago had announced this partnership, and they will be joining us here at our North and South clinics to provide services that are difficult for us to provide, women's health services and family practice services and things like that. And so we've already begun that partnership. We will be testing in the community in partnership. And one of the most vulnerable populations that I'm most concerned about are the long-term care facilities, those being the memory facilities, the nursing homes, the senior living facilities. And so we have a long-term care team now that manages that population in our community, in our county, checks on each of them twice a day now, and also provides them with PPE, protective equipment, masks and face shields and such. And also when they require testing, I go out in full PPE and provide testing. So it's a long answer, but I'm sure I missed some facets of the care we continue to provide. But it's a lot of moving parts, and we are working hard to continue providing care, because you just can't. There's so many medical practices that are shut down right now and no longer provide care. They'll maybe even answer the phone, but often not. And so we have a large community that their healthcare needs haven't gone away, and so we have stepped up to continue providing the services.
And as a reminder, there's a lot of resources that, even if we have a large contingent of home visiting nurses, that a lot of their time has been shifted to doing the contact tracing and the case investigations, but there's still a portion of their time is committed to those clients that they had before this happened. Moms at higher risk for complications, for example, and they're doing those televisits with them as much as they can and trying to continue that care, whether it's via FaceTime or the phone, et cetera. And so again, as a reminder, our Nurse on Call line, 1-800-848-5533. Even if it's not a healthcare need, that Nurse on Call can really help connect people with supportive resources. For example, food. They are collecting on a daily basis and keeping a list updated of where there are free meals available if you're in a certain school district, for example. So a lot of those resources are available through that. And I just really want to bring up the conversation, really kind of touch on, Meghan, what you kind of started to allude to, is that a lot of places are changing the way that they're doing business for those healthcare needs that have to continue. The healthcare needs, as Dr. Faust said, have not gone away for these people. So how do you do it in a different way that's a little safer? Now, when all of this is over, it's not going to just snap back to normality. I think what's going to happen, whenever that is, and if anybody tells you exactly when it is, I probably wouldn't listen to them, because you just don't know. It's impossible to predict when everything's going to kind of loosen up and come back to normalcy. But when it does, it's going to be more of a gradual approach. A lot of offices, a lot of healthcare providers who maybe haven't dabbled in telemedicine, maybe are now. And they might realize, hey, this can work for some clients. And they might have that be more of a bigger part of their practice. Or maybe some companies who were hesitant to go to telemedicine because they just didn't know if the technology existed. They didn't want to explore that avenue. they're kind of being forced to explore it, and they might realize that it wasn't as bad or wasn't as hard as they thought it was going to be. And they might keep some aspect of that when things come back to being somewhat normal. And, I think this is going to change a lot of also like reimbursement, a lot of the system knowing that, hey, if we reimburse for it, we can get the same level of care. And it might be valuable to make it a little more financially viable for some providers to continue to do this. In rural communities, this has been a thing for them because there's so few providers out there in those rural communities and such a large distance for people to travel. This is something that are kind of maybe ahead of the curve a little bit on us urban and suburban people. And so I think that as we move forward, you're going to see a lot of things that we're doing now that we have adopted, a lot of these practices. Some of them are going to stick and some of them are going to stay around at least to a certain amount.
Yeah.
Very good. And I think too, it will loosen up those, like you said, insurance companies were really the ones that were holding people back before and wanting, more of a face-to-face person visit. And it wasn't allowed. You weren't getting reimbursed to do telehealth. So a lot of that has loosened right now. So maybe it will continue in the future. Like you're saying, that'd be wonderful.
Yes.
Speaking of insurance companies, people are getting very worried about the costly treatment of this, like going in and being on a vent in an ICU for so many days is extremely expensive. I know they've talked about waiving copays and that type of stuff. Do you guys know of any, programs that they're putting in place? I mean, these are experimental drugs they're using against this. What are we looking at cost-wise for patients out there? People are getting kind of worried about that.
I think the best resource for that kind of hospitalization data would be from the hospitalists right now. We're not involved in those programs. I agree. Very costly. 2 or 3 weeks in the ICU is potentially hundreds of thousands of dollars.
Yeah, from a community standpoint, can you tell us where people can get more up-to-date information, what they can look at every day instead of going to these giant news outlets that really just want to generate them to stay on the TV all day and generate ratings, right? And put that little scare factor in, which maybe some people do need to be a little more scared, but where can they get more up-to-date information?
Well, a place they can go that doesn't have a lot of link bait on it would be, oakgov.com/health. And that's our main page for Oakland County Health Division. And it's easy to get to our dashboard for numbers within the county and resources and that sort of thing. And again, Shayne can provide the nurse on call number, which is, I think, a fabulous resource when people have questions and, for example, don't have access to the internet.
Yeah, and so our nurse on call, 1-800-848-5533. We also have an email address, which is noc@oakgov.com. That's oakgov.com. But in addition to our website, oakgov.com, and there's a big red button for COVID-19. If you simply go there and you could get to our dashboard, you could get to our map that we have for infection rates in Oakland County to see where it's most prevalent. And again, remember, it's widespread in the community. So if you're in a lower prevalent part of Oakland County, don't think that you're safe. But you can also go to michigan.gov/coronavirus. And they have a wonderful dashboard. They have wonderful information at a statewide level. And they've broken down a lot of the data by cases as far as age group percentages of people hospitalized. And they're trying to push as much solid information out there as possible. The CDC's page, cdc.gov, is great for national information. But I'll be honest with you, it can be hard for a normal person to navigate. There's just so much information on there that it's a little bit like reading stereo instructions. Unless you know exactly what you want to go in there and look for, it's pretty difficult to just peruse for light reading. And also, it changes regularly. It changes, it seems like, on a daily basis as their policies and advisories and guidelines change, which can be frustrating. Right. So if you're looking at it, know what you're wanting to find, go and find it. And a lot of the data on the CDC's page is always a step behind that particular state's information. So if you want to know about Michigan's information, you go to Michigan. If you want to know about Oakland County's information, you go to Oakland County. The information is just slower to filter up to the national institutions like the CDC. So those are great, solid websites. They are just have slightly different purposes for each one that you want to go to.
Thank you. We really appreciate you guys coming on and answering some questions. Do you guys have anything else you'd like to share with the community?
Ignore those suggestions early this week that we have already reached the peak and are on the far side. I really, really want people to avoid gathering for this holiday weekend. I will say this, fortunately, the governor and Dr. Caldoun received the message that that is the wrong thing to tell our communities right now. And in fact, we have not reached the peak. We haven't reached the peak in Detroit, in Oakland County, in Macomb County. We are still adding cases every single day. I'm not sure where that little rumor occurred on Monday or Tuesday, but that is really a disservice to the effort to self-isolate, socially distance, continue being locked down so that we can put an end to this. You know, if we can prevent people from bringing, especially family members in from out of state or from distant towns and villages in state and gathering for this holiday weekend or over the next week or so, I'm confident that we can get to the peak and down the far side, and we can get through this. We really want to avoid kind of the second peak anytime soon. We need to get past this. So I want to beg people not to bring relatives in from out of state for this holiday weekend. It's really interesting, Dr. Faust. I was thinking the exact same thing, and it's because I'm somewhat active on social media in my own personal circle, and I've already seen it start to happen. I've already seen a few posts about an article here or an article there where it's time to start loosening up some of these restrictions. This hospital didn't get used as much as they thought it would. Can we just open it up? And that conversation is already started. And that's the conversation that's the most, because right now, during the most infectious period of time, is the hardest part for our healthcare providers. However, the hardest part for the rest of us is going to be after we get past that peak, whenever it is to continue to do the social isolation, because the immediate threat is going to seem like it has passed. And there's going to be a lot of social pressure. There's going to be a lot of political pressure. Yes. Start opening things back up. And that is worrisome. And that is what is going to be the most difficult conversation for the rest of us to do. And so anybody who is watching, your audience, it's important for them that when we do get to that point, is that they remember the fight is not over. It's just moved on to a different phase.
Thank you very much. And I think from a nursing standpoint too, all of my friends that are still in hospitals, working in ICUs, I mean, they're feeling the brunt of this. They're picking up extra hours. They're killing themselves to make sure that your family members, remain safe and healthy and kind of continue them on, or if they're in the ICU, to support them through this time. So really, from a nurse too, we're begging you, stay home.
Thank you.
Yes. Maggie, you want to wrap this up?
Yep. Thank you, gentlemen, for all of your insight and this great information. This will be going out to the community, and hopefully everyone listens. I thank you for all of your good information, and the community does as well.
Thanks for all you do.
Appreciate it. The opportunity.